Hi there, welcome back. Today's talk will focus on the hemangioma. Here are two hepatic lesions. This one is from adult, this one from an infant. They look quite similar in the sense that they have peripheral nodular enhancement and will fill in the later phases. So, are all hemangiomas created equal? For part 1, let us first describe the very common lesion, popularly known as the typical hepatic hemangioma. This is also sometimes known as the cavernous type or cavernous hemangioma. Imagine that this apple is the hepatic hemangioma. Again, this is commonly called the cavernous hemangioma. What do you notice? See these maze-like dilated vascular channels, some with cavernous or cavern-like dilatation. This lesion has relatively stagnant blood flow or stagnant blood within it. Meaning, if one would inject contrast into a peripheral vein, as shown here, or as depicted here, the lesion would slowly fill in, just like this. It will initially have a peripheral nodular enhancement. Then eventually, it will slowly fill in. On CT, one will see this relatively stagnant blood as hypodense. On MRI, one will see a T2 bright signal. Because of this many small vascular channels, one will see on ultrasound a hyperechoic lesion. Why hyperechoic? To remember this, try to imagine what a vessel would look like on ultrasound. Don't these vessels have echogenic walls? So these endothelial-lined vessels in the lesion are responsible for the hyperechoic appearance. Now, what about Doppler? Knowing that this is a vascular lesion, one might expect that there will be an intense color Doppler signal. But see here, there is no Doppler color signal. Why is this so? While the literature does not exactly say why, we can relate this lack of Doppler signal to this third pathologic finding here, this one. Because the blood flow within the lesion is relatively independent from the vascular system, in a way, the lesion is shielded from the systemic pressure that arteries and veins are constantly under. So when you put on the color Doppler, one will not find a classic arterial or venous waveform within this cavernous hemangioma. This slow blood flow is also responsible for the findings that we see in scintigraphy. When one would inject tagged or radioisotope-laden RBCs, the RBCs will light up the lesion as time goes by. So now we know the pathology of the hemangioma, which explains its imaging appearance.